Welcome to Health Talk. We're so excited about this show. It's about, oops, I forgot to take my medicines. Today we have with us Dr. Mary Rithuvarki, Brian Lung, and Kevin Liu. We're going to talk about this important topic because everyone at one point in their lives have forgotten to take in their medicines. Don't you think?
Yes, yes, Dr. Liu.
Right, definitely.
Even normal people, educated people, at least once in a while, they would have forgotten to take their medications, and that's very common.
So even if it's only for a 14-day course of antibiotics or a 7-day course of antibiotics, people forget. And even if you're administering to your child, people forget to administer. Tell us a little bit about pharmacies and how they've played a role.
Yes, actually pharmacies are trying to help patients take their medications, and they're more into medication adherence. So they have formulated a model called as the appointment-based model, where the patient can actually call up the pharmacy and actually assign a pharmacist for themselves, where they will help you with synchronizing your medications in a timely fashion, so you don't have to make frequent trips to the pharmacy. You can call them and give you a list of medications, and the pharmacist will actually assign the medications accordingly, and before the refills end they give you a call, which is like they remind you saying that the refills are ending, and you can actually go and refill them. So it's like they assign you all the medications, how once in a day or twice a day or accordingly, and you also have to prepare your own medication list. They also encourage the patient to give their own medication list, and if the patient's doctor is having any change in the medications, to highlight to the pharmacy. So that's very free, and this is free of cost, and I don't know if so many people are aware of it, so they can.
So we can theoretically call up CVS, Walgreens, Walmart, Rite Aid, and request a pharmacy person to talk to us if we have many medications.
Yes.
Many people have 10 medications or 7 medications, and it becomes increasingly hard. For example, we have this famous pill box where everybody has one, where you put your medicines every day of the week, but if you have 10 pills, it's hard to fit in this. So they created something called Pill Pack in 2013, where once a month, if you took medicines 4 times a day, it would come in a little plastic bag. In a perfect world, if money were no object, this pill pack, I think, should come with a little chip that says, "Hi, Mrs. Jones, today is Monday, June 3rd, and this is your first medicine," because people could get it delivered, but what if they forget where they put it? Or what if they are disorganized and the cleaning person moves it, or they have cognitive memory loss and they just can't remember? So even though it comes to the house, we don't know if it gets into the mouth of the patient. So it's many reasons why people don't take their medicines. Brian, you want to talk to us about apps?
Yeah, there's a number of apps that we have to kind of target people for getting their medications. So some people might have alarms on their phone to remind them of medications. They can set it every day at a certain time, and they can also have like a voice reminder on it as well, to have a family friend or even your own voice on that alarm to kind of remind them, hey, it's time to take your medications, this is the time, these are your medications, things like that.
On the iPhone and also the Droid phones, you can change your ringtone, record your own voice.
Right.
So if grandma can't remember, they hear the daughter's voice or the son's voice, which is a much nicer alarm
Reminder,
than
right.
a ding, ding, ding. And also it's positive reinforcement. You get to hear your loved one's voice, your child's voice, rather than just this robotic voice. You worked in a nursing home. Tell us a little bit about that experience in medications.
Right, so a lot of the people who I worked with at the nursing homes, there were the aging population, so meaning 65 and older, so many of them had memory issues, so it was hard for them to remember to take their medications. And also other issues that I encountered were that they couldn't open their medication bottles, or they couldn't read their medications, and once again, they would forget their medication. So one of my responsibilities was to remind them to take their medication. So it's very important to not just have a a set reminder, but also to have someone else that's accountable too. Like for example, having a home health aide to come in and check on a elderly person is very helpful in improving medication adherence.
Now, you were saying that sometimes the nursing assistants or the nurses who crush the medicines, there's spillage.
Right. So one issue with medication adherence in the elderly population is that when they have to take these big pills, imagine like taking a multivitamin, they're really huge. Even for me, it's hard to take them. So imagine,
hard to swallow.
Right, imagine a 65, 70-year-old woman trying to take these medications and they have a gag reflex. Well, as a result, they don't want to take these medications because they have these associated bad feelings with taking these large pills. So as a result, sometimes it's authorized to crush these pills, put them in applesauce, ice cream to administer to the patient. But as a result, sometimes I think it was reported that in these nursing homes that there was a report that there was a 70% rate of spillage, and also that these people have to eat every scoop of their ice cream or applesauce, and sometimes these patients, they don't want to eat the applesauce or ice cream, so they're not effectively taking the dosage that is that the doctor wants them to take.
Also, in addition to that, is that for the elderly, if they've had a stroke and they are in a nursing home for rehabilitation, they may lose their ability to swallow as well as they used to before the stroke. And they cannot, and people with slurred speech, they already have problems negotiating all the mouth muscles, so it's hard for them to chew, swallow pills, etc. And sometimes they choke. It's a problem as we all have more birthdays. Another thing is that in this thing about taking medicines and forgetting it, it's called medication adherence, patient compliance. These are fancy terms, but it involves the stakeholders of the patients, the doctors, and the pharmacists. The pharmacies lose money because 50% of the medications are not picked up. So that means that CVS has bought them from an intermediary and it's sitting on the shelf. And then these medicines are sitting there. They're not helping Mrs. Jones, Grandma, Uncle Peter, because they're just sitting on the shelf. And then as doctors, as a physician, if you don't take the medicine, my patient is not going to get better. They are still going to have the same course of disease. Mm-hmm. I feel bad. I give them more medicines. I think, I should give stronger medicines. When in actuality,
they are actually not taking the medication.
They didn't even take it. So then by that time, the patient may be overdosed because they didn't take the original one. Now you're giving a stronger one because they still have high blood pressure or, in my case, glaucoma. So it is a problem. It is a gigantic problem for American medicine, for third-party payers, insurers, for Medicare, for the government expenditure. And then for people who don't get better, they are still sick. So you're in internal medicine. So what are the common things that happen?
Yeah, so usually patients think that so many medications are so cumbersome for them to take on a daily basis, and sometimes they are not aware of what the medication side effects are, and they don't know what exactly it is doing. So if there are like 3-4 medications for high blood pressure, they think taking 2 would be fine, whereas they don't know the mechanism of action of each medication, so each might be targeting different systems in the body. So if though they are treating it for the same blood pressure, so they think that taking 1 or 2 would be fine, and that will help their blood pressure to keep under control, whereas
or they think, I feel fine today,
yes.
I'm going to skip my medicine.
Yes.
Whereas hypertension, high blood pressure is silent. You don't feel it. It's just the chronicity of it that gets you at the end, that leads to heart attack, stroke. Also, in my case, as an ophthalmologist, I see glaucoma patients and I see patients post-op and I see patients with various diseases such as uveitis where they need to take medications. So we started giving them a medication reminder list where we say, this medicine, the color is a red top bottle, this has a white top bottle, and we write the name, we say 3 times a day, 2 eyes, etc., or right eye, left eye. And we found that to be really helpful. And in the pharmacy article, they talked about how to prevent this problem, and they say that all pharmacists and doctors encourage patients to have a list of
Yes.
their medications, have their children their adult children type out the list on their iPhone, on their smartphone. If they don't have a smartphone, have it typed on a sheet of paper, carry it with them with their driver's license, with their allergies, because God forbid they get in a car accident, all this is known. Because it would be very bad if something were to happen to grandma or a favorite uncle and something happens, they go to the ER, we have no idea what medications, what their allergies are, they start giving medicines right away to revive the patient and they become allergic. So important for everyone to have a medication list on them at all times, like their driver's license.
Also, because I want to add one point to that, because you're working with so many doctors and you're seeing so many specialty doctors, so each one might have their own list of medications, and sometimes the other doctor is not aware what the medication, what was the change in the medication, or whether the new medication was added. So it's always important to carry a medication list so all the doctors know we are on the same page.
Yes, and theoretically with the Affordable Care Act and Obamacare, everyone having electronic health record was theoretically supposed to solve this problem. So it has solved the problem in a way that patients and their records are sent to other doctors seamlessly electronically. However, not all systems speak to each other, so it's still important for patients to carry a list of all their medicines. And multiculturally, it's hard. Tell us about your experience, because you were in a nursing home where they spoke different languages, where they don't have a list of medicines.
Right. So most of the time, when looking at these prescriptions, the patient, they don't understand or they don't know which prescription they're taking because either the language, either the generic or branded name of the medication is hard for them to pronounce. They don't speak the language, or they don't speak English in which the medication is printed on. So actually, I know that CVS and Walgreens, you can have your label, the drug label printed in Spanish. So it really helps, especially when I was in San Diego working with the Hispanic population, that when their medications were published in Spanish, that they knew what they were taking because they could read the Spanish. While if it was just regularly published in English, then it would be more challenging. So pharmacies are trying to slowly move towards publishing their prescriptions in different languages. So not only can the patient be more aware of what they're taking, but also the caretakers and families as well.
Now, in the smartphone, I think it's important, any smartphone, that I tell my patients to take a picture of their medicine. You know, take a picture of the bottle, the pill bottle. So then we have some idea. Because sometimes when you're having all these pills in here, it's a little blue pill, a little white pill, a little green pill. That doesn't really help us as much. And although it's better than nothing, but so having a picture of the bottle is very important, the prescription bottle, because it'll tell the doctor, here's a picture. And then Grandma or Uncle Peter will have it, and then they can show the doctor. There's still many elderly who do not carry a smartphone, so the piece of paper is still a very good thing. The other thing that was very interesting, I came across the statistic that 80% of hypertensive patients do not take their medicines on time or at all or correctly. So that's a high number.
Yes.
And now because they changed the guidelines for hypertension from 140 over 90 to 120 over 80, less than 120 systolic and less than 80 diastolic, that means 100 million more Americans are considered hypertensive. That means 100 million more people need medications. Yes. That means that many of them don't even know that they are now labeled hypertensive. So this problem with taking medicines will only increase because more people will need it, pharmacies will have to stock more, and yet we're not getting it there appropriately.
Right. With changing the guidelines, I think one issue that you alluded to, Doctor, was that patients who had to take like a lot of different prescriptions and medications. I think I was reading one stat reported by the Mayo Clinic was that 20% of American adults take 5 or more prescriptions daily, different prescriptions daily.
That's a
So,
lot.
yeah, so imagine trying to keep track with all of these medications. So I think one benefit of having a pill pack is that the patient can keep track of which medications that they're taking, and specifically, what time they're supposed to be taking these medications. Because, as you know, some medications, blood pressure medications, are daily. Some could be, some could have different.
Twice a day.
Yeah,
Yeah, 3
that could be
times a
done
day.
at different times of the day. So that's why having pre-partitioned medications is very useful, or subscribing to pill pack or a CVS Mulitdose, that's very helpful too for patients who take a lot of different medications.
So pill pack is free, and it depends on your insurance coverage.
Right.
If you're Medicare Part D, it usually covers. However, there are some areas where it does not cover. And CVS multi-pack, you have to pay all your copays at once. So if you pay all your monthly copays for your 5 medications, it becomes rather costly. So, but this is better than nothing. And also, if you imagine putting 5 pills in this little box
Right.
per day, you're going to need 2 boxes or a very large one of these plastic containers. So it's an interesting problem and something that we need to address. And some of the mobile apps have the ringtones, have the ability to plot it. They can even send it to your doctor, and the doctor will know. But doctors also are busy. They may not be able to keep track of their 5,000 patients who have hypertension and who is not keeping up. And it's very important to somehow, as all of us in the healthcare industry, understand this is a problem and how to help our patients.
I really encourage that, because we all have to work as a team with the pharmacy, with the doctor, the patient, and all the other physicians. And we also encourage patients, tell the patients to stick to with one pharmacy rather than buying medications from different pharmacy. In that case, that becomes more confusing for the patient and also for the pharmacist.
So one pharmacy asks to have one pharmacist assigned to you.
Yes.
This is usually free.
Yeah.
And make a list of your own
Medication
medications
sheet, yes.
and give it to all your family members so that they know in case you run out. And consider pill pack or CVS multi-dose
Yes.
packaging. So these are very important considerations. Knowing your pharmacist is good. Buy a box of cookies once a year so they feel that you appreciate them and they remember you in particular. Because pharmacists are very important to this equation. They like to know all the medicines because, as you say, there are 5 specialists. If you have hypertension and diabetes, you could also have a kidney doctor.
Yes.
You could also have a heart doctor, and you have your eye doctor. So you have many specialists giving you all medicines, and sometimes if you don't give the complete list of medicines, the ophthalmologist may not know that some of these things interfere with your glaucoma medications, interfere with your cataract surgery that's being planned, because certain urology medicines affect your cataract surgery procedure. So these are all very important, and none of us as patients have time to look up all the side effects. And the pharmacists have a PhD, and they are certainly willing to help you. And now they have in all the pharmacists, even a clinic. You can talk to a nurse practitioner, and they will bill your insurance. So they're all trying to help the patient get to a better outcome for their illness or their disease, their chronic disease.
Yeah. Talking about interactions, pharmacists know a lot more because they deal with all these issues on an everyday basis. So they know more of the interactions and what medications and what dose. Sometimes the doctor might not be aware of what the other doctor is giving them. So the pharmacist can really highlight you on that issue.
And also the pharmacist will also tell you that prednisone you should have with a little bit of milk or milk of magnesia, and like Biaxin, clarithromycin should be taken with a little piece of bread or something.
And like the thyroid medication should be taken on empty stomach, so the absorption rate is good.
Right. So they will tell you these specifics, which your doctor may tell you, but in the busy office setting, where many clinics, 9 minutes is allotted for a new patient, 6 minutes for a follow-up, nobody has the time to talk to you, and the nurse practitioner or the medical assistant also may not have the time to talk to you. They're ushering patients from room to room. As medicine has changed in America, people must take more care in their own health by having sheets of their own lists of medications. Yeah.
One of the pharmacies that my mom goes to, the pharmacist always takes the time to kind of explain to her, these are the medications that you have, these are kind of the interactions you might have, and be sure to call us if you have any questions or things like that. And since my mom goes to a local pharmacy, they do speak Vietnamese or Chinese to her, and it really helps in understanding all the information that she isn't normally able to get when people speak to her in English.
Yeah, it's also important to know that there are companies like NowRx that will deliver to your door. Right. The doctor writes the prescription to NowRx, and then they will have somebody deliver it that day. So that helps. And there are also other specialty pharmacies that exist in our area that will make for grandma, if she cannot swallow, a elixir, a liquid. So the medicine could be made in a liquid. And they have different flavors, strawberry, chocolate, vanilla, and it helps.
Yeah, and if the cost is also a huge concern for the patient, some medications may be too expensive, so they usually can talk to their doctor if they can give a generic form. That can also be done. It's much better than taking no medication.
Right, and some patients they say, I feel good, I'm not going to take my cholesterol medicine today, and they don't tell anybody.
Yeah.
They don't mark it in a diary. They don't. So at the 3-month interval when they do the lab test, the doctor says, oh, your cholesterol's still high. They either switch to another medication, not realizing the patient didn't take it on time or missed 5 days out of 30, and or increase the dose. And meanwhile, the patient forgets to tell the doctor, or they don't keep a diary. So they'll say to the doctor, I only forgot once this month, when in actuality they forgot 5 times this month or 10 times this month, which can then affect the course of the illness.
Right, and I think that's probably the scary thing about these chronic diseases like having high blood pressure, is that you feel okay, like it's asymptomatic, meaning that sometimes you don't feel like there's something that's wrong with you, but the fact is that if you don't take these medications, you're at higher risk of stroke, heart attacks. So it's very important to when you look on the label on the pill, on the prescription, it doesn't say take when needed or take when you feel bad. It says take once a day, and it's important to follow those instructions because they're set by your doctor for a reason.
Right. Yeah, so I think it's hard to explain to some elderly because they're very polite to me as a doctor. Yes, doctor, I'm going to take it. Yes, I did take it all month, because they don't really want to have a confrontation and say, oh, I was bad, I didn't take it. So there are also cultural differences and gender differences, because maybe some elderly females of a certain generation may not want to say to their doctor, oh, I didn't take it 50% of the time, or they totally forgot they didn't take it 50% of the time because they have cognitive dysfunction already. So it's a problem. And there's also cultural barriers in the sense of linguistic barriers, like multiple languages. In Santa Clara County, where I practice medicine here, there's 166 languages. And so it's, people speak Hindi, they speak Chinese, they speak Vietnamese, Japanese, Korean, so it's important to find some way to reach them. And also, even if you speak English, if you only have a 3rd grade reading level or a 3rd grade comprehension level, it's very hard to pronounce brimonidine, which is the generic of Alphagan. It's very hard. How are they going to remember BRIM, et cetera, et cetera? So we're coming to the end of our show. We have a few minutes to talk about the wrap-up for the take-home message. So what's the take-home message for
Yeah,
all
from
of us?
my side, I would recommend all the patients to have their own medication sheet, like which they can carry it one for them, and for every doctor whom they see, they can give one copy. And if there's a recent update on any of the medications, they should always call their pharmacist and also their doctor and tell them then that is the change which has been made.
And the take-home message for you?
Yeah, there's dedicated apps to fix issues with taking your medicines, like not on time. There's alarms. There's also some apps in the pipeline that allow you to kind of take a photo of yourself when you take a medication, and then it keeps a track of it to make sure you do it.
Right, and also for the aging population, I think there should be special consideration, whether it's having a loved one or maybe having a home health aide, to make sure that your grandma, your grandpa are taking the medications, because I mean they're more likely to have more different medications to be accountable for. So to have someone else to help them, whether it's administer the medications or to remind them, to have someone else there with them to feel like they're not in this by themselves, it will be very helpful.
So thank you for the home audience for joining us. We're thrilled that you are looking at Health Talk with KSAR TV. If you like us, make a donation, and remember, take your medicine, whether you do pill pack, CVS, or have a written list. Thank you very much for joining us.